Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program focuses on different healthcare issues and services provided by KRMC. I hope you'll stay tuned because I've got a great guest on the show today. We're both going to learn a lot. I'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Paige Ayers. She's an occupational therapist here at Kingman Regional. Thanks for being on the show, Paige.
Thank you for having me.
So first, I want to get to know Paige better. So, and I'm sure my listeners do too, my watchers do too. Share with me what brought you to Kingman, how long you've been here.
I've been here a little over 3 years,
and
really it was the job.
Okay.
I was looking to move west, and I had actually kind of settled on a job I was going to take in Idaho, but the hospital said, well, come on out and have a look at us, and I did, and I ended up here instead. I was that impressed with the hospital. So.
Great. Yeah, KRMC's, I'm proud of it, and I know most of us are that work here too. And the weather's, you got to say, is a whole lot better. You'd be shoveling right now, I think, in Idaho.
It was nice and warm here.
Yeah.
So.
Absolutely. Well, we've had an amazing fall, and the only thing I'm concerned about is that Mother Nature is going to figure out, oh, yeah, I forgot about Kingman, and going to come back and dump.
Yeah.
But hopefully not. We'll see. Anyway, so you've been here 3 years. Where were you before that?
I was in Illinois, which is where I was born and raised,
Oh, okay.
but I've worked
Around the country?
Yeah, pretty much East Coast to as far West Coast as you can get.
Oh, wow.
So,
But how did you become an occupational therapist? What started that whole?
Well, I have a lot of nurses in my family.
Oh, okay.
My mom, my sister, my aunt, and it seems like in my family you either work in healthcare or you're a teacher. And my cousin was actually an occupational therapist, and I was in college, and she came to visit one summer, and my mom said, so what are you going to do with that biology degree? I don't know. So I got to talk to my cousin and found out what she did, and thought, you know, this is something I can do. I wasn't really sold on being a nurse, that's for sure. So, and I was lucky enough to get into a good school, and it has given me more opportunities than I could have ever imagined.
Super, super. So you've traveled around the country, now you're kind of settled into Kingman. And as an occupational therapist, exactly what do you do? What is an occupational therapist?
Well, I've been fortunate enough to work in almost every aspect of what an occupational therapist can do, with the exception of schools. What I do here is, you know, if somebody has an injury or illness that leaves them unable to do something that they want to be able to do in their day-to-day life, is really what my job is. I want to get you back to being able to do the things that make your life your life.
Okay. So like physical therapy is more specific exercises for
their focus is a little more on mobility, as far as walking, lower body strength. An occupational therapist, our basis is function, and what is it that I'm going to work with you on? What skill are we going to improve to make your life better? And we tend to focus a little more on fine motor skills, more upper extremity hands, that type of thing.
Hand to mouth type of thing?
Well, not just that, but
no, but I mean, as an example, and what other kind of things? I mean, what other kind of injuries or illnesses do you see daily that you work with?
People that have had strokes and maybe have lost the use of part of their body. We'll teach you how to work around that, how to compensate so that you still can do what you want to be able to do with that disability.
So that it's not so totally debilitating that you're actually
Right. We want to focus on what you can do, not what you can't do,
do.
and what we can do to give you back that independence as much as possible.
That's awesome. So do you work closely like with the acute rehab unit?
Yeah, I'm actually part of the time up in the acute rehab unit, and part of the time down here in the outpatient center. And yeah, we work very closely with the physical therapists up there, and that, you know, what we do for those patients, because they're not able to function at home yet, they're not able to be at home. So our job is to get them so that they can. and it's very important that we work as a team to do that. So
To
there's
get them out of the hospital and at home, and then you
Yes.
continue to see them.
right. Then if
Keep
say
them
they've had
going.
a stroke, yeah, I'll get to see them in outpatient to continue to improve the fine tuning things that need to be done.
So that's located in the wellness center, right, where you work. We have that special gym area that you work with them at, and then you also have the pool side.
Yes.
So what is that all about?
Well, I recently started to have a little more interest in aquatics with my work on acute rehab. Having some patients, I really didn't know what to do because we were kind of stuck. And I got them in the pool, and we just had some amazing results.
Oh.
And so I got some more training, and now I'm going to kind of translate that into not just work with my patients on acute rehab, but also an outpatient. People who have limitations in their movement, their balance, chronic pain syndromes, that sort of thing, to just help improve people's quality of life. So
Now, I've heard that working out in the pool, it's great for those that either for instance, have bad knees or whatever, and so you don't have that pressure. So when you're in the land.
Yes. There's wonderful benefits of the pool. First of all, our pool that we use, or that I would use specifically, is a therapy pool. It's not a typical pool that you
So
would
it's
get
not
into.
like you're going to be in the big
No.
pool with all the other folks.
No.
You have a little bit more.
Right. We have a dedicated therapy pool, and the temperature is much warmer.
Oh, that's nice.
We keep the pool anywhere between 88 and 94 degrees.
Okay.
So when you get in it, it feels good. Then that's by design. That's part
Okay.
of the therapeutic effect of the water. The buoyancy, the unweighting that you were talking about, you know, you can get up to 70% of your body weight off of your joints. So it's going to make it a lot easier for you to move. So, and then we just kind of go from there. The effects of the water and I wasn't sold on it till I saw it, and then I'm a believer, that's
Well,
for sure.
very good.
So-
So how long have we been doing that here at KRMC?
The aquatics, as long as I've been here, we've had
Oh,
an
okay.
aquatic program,
Okay.
but we've had different people doing the aquatics, and each person's kind of had a different approach to it.
Sure.
The last few therapists that we've had were pediatric therapists as
Okay.
well, so they tended to have more kids in the pool. But now there's 3 of us that have some specialized training in a new technique that we're pretty excited to be able to use for people to improve their mobility and their function. And so we have some pretty good flexibility in people that are pretty rooted here in Kingman. They're not people that are kind of coming and going. So.
That's cool. That makes a big difference, too.
Yeah.
That's one of the things that I love about Kingman, and we talk about that on the show all the time, how you, living in a community like Kingman, you run into people you know all the time, and I always make sure and tell staff it's all the more reason why you have to make sure you give them the very best, because you could run into that patient at Walmart or
Right.
Safeway or at the theater. You want them to go, oh, hi,
Yeah,
be
and-
glad to see you, versus
Right, right.
So it really helps reinforce the importance of good patient satisfaction, taking care of our patients. That sounds like a really cool program. Something I may have to look into
Yeah,
as my
you
joints
should.
keep getting older. Okay, so then we've got a wheelchair program you were sharing with me before the program.
Yeah.
Tell us a little bit about that too.
One of the physical therapists and I've worked with wheelchairs and mobility almost my entire career.
Okay.
I've been a therapist for over 16 years. And it's something that I've taken with me every different area that I've worked in. I've had the ability to kind of make recommendations for people that need specialized seating and positioning. And we're fortunate enough to have another therapist here as well that was interested in that area as well. So she kind of took the rein and said, let's start a clinic, which basically allows us to once a month see patients who have mobility related problems. Most of them are in need of some type of mobility device, a wheelchair, a scooter, a power wheelchair. We have kiddos that need specialized positioning if they're pretty young, in strollers even. And so Trish and I work with some big companies out of Vegas and Phoenix, and pretty much anyone who wants to come and work with us if they have a patient is welcome. And we do a very comprehensive evaluation that kind of encompasses all the different areas that someone might have a problem with. But we also make sure that whatever kind of mobility device they get is going to work in their home environment. That's really important.
Doesn't do you much good to work out great here and then go home and can't do anything.
Right.
Okay. So
right.
that
And I've
makes
seen
sense.
that time after time, people that get something and then they can't even get in their front door. And then they're stuck with this, you know, pretty expensive piece of equipment that's not going to work for them. So we need to look at that piece of the puzzle and make sure that, again, that it's gonna translate to helping them in their day-to-day life.
Sure. Okay. So what kind of things are involved with that? I mean,
It's very involved, actually. We have, like I said, a very comprehensive evaluation that we complete, and that involves, we look at your mobility, we look at you know, how well you stand, what your balance looks like, your range of motion and your movement in your arms and in your legs, and also find out about your home. And then we translate that into, you know, what you're going to need to be safe, you know, throughout a day. We try not to just take a snapshot of where you are right here and right now, but we try to get a big picture of what your day in and day life is like, not just how you look to me today.
From the time you get out of bed till the time you go to bed.
Exactly. So, and that's kind of how we determine, you know, I can see somebody and say, I want them to look like this in a chair. And then thankfully we have really good vendors that will come and they bring us different pieces of equipment that we can try with people. So we have the things there that we can say, well, this is a type of cushion that I think will work for you. And they may say, well, that's not very comfortable. Okay, here's another one for us to try. That will accomplish the same thing, but is, you know, made a little differently.
So it helps like with the patient's posture type of thing, or when you're
some people too that may have pressure ulcers because they're not able to move. We will try to eliminate that problem with their positioning and maybe a feature on the chair that will put them in a different position so that they won't be stuck in one place in one time. You know,
so we have chairs that can be repositioned.
Oh, yes.
I never knew that. See, I always just figured you got a wheelchair.
It's just a wheelchair.
It's like a chair on wheels.
Nope.
There's lots more to them.
There is, and that's why it's pretty important, I feel, to have somebody who knows the body to translate to the equipment, and that's why Trish and I work with the vendors very closely on. They know what equipment's out there. We know what they need to have the best outcome for their body, and so we work together to give that to them.
Super. I just didn't realize that there's so many different. Like I said, I just always assume there's a wheelchair, and it's a chair with wheels on it.
You can just go into any store, grab one.
Some are wide and some are not. And well, I know when I broke my ankle a few years ago and had to be in a wheelchair at home because me on crutches is not a good thing. I'll tell you that right now. So I was fortunate. I had an electric scooter that was my mom's that I had borrowed that I kept in my office, and I just whizzed around the office, you know, through the hospital on that. That worked great. But then at home, I borrowed a friend's wheelchair, and the first one I got didn't fit through the doors. It was like I had lots of room. It was plenty big, but it didn't fit through doors, so it didn't do me much good. And then I got a second one that was narrower. And
anybody that's sat in a whelchair for any period of time, you find out pretty quickly they're not very comfortable.
No, they're not. They're good, just kind of to help get you from here to here.
Right, but for some people that's where they are for a majority of the day. So we need to get them something that's going to keep them comfortable and keep them safe and not lead to more issues down the road. So.
Okay. Well, we're going to talk some more about that. We've got to take a quick break, and we'll be right back. So stay tuned. We'll learn more about wheelchairs and all that other good stuff. We'll be right back after these messages. Welcome back to Your Health Matters. My guest today is Paige Ayers, an occupational therapist here at Kingman Regional. Thanks again for being on the show, Paige. So we were talking before the program break here about both the occupational therapy, but your aquatics program and the wheelchair program. All of those are referral, right? So if someone needs those kind of therapies, they're going to have to go to their primary care physician. Is that correct?
Yeah, anytime you need to see a therapist, you need a referral from your doctor, and depending on what your need is, if it's a mobility need, you can have your doctor write you a prescription for an occupational or physical therapy evaluation for wheelchair positioning needs, that sort of thing.
Okay.
Or if you're looking at more the aquatics, it can be for aquatic therapy, physical or occupational therapy.
Okay.
And then if it's more of an arm injury, broken wrist or something like that, then just regular occupational therapy prescription.
And that way, for the most part, insurance is going to cover that, right?
Yeah, and our office staff, when you have the prescription, they verify your insurance benefits before to make sure that
So
you know
upfront
what's right,
what to expect.
Right. You know what's
Okay.
going to be covered. If there's any responsibility on your end, that they'll let you know that ahead
Okay.
of time, so that there's
So
no surprises.
If someone has questions about any of these therapies, they can call that your office, and that says 692-4186.
Yes.
I'll say that clear again, so people will get the number 692-4186, and then they could answer questions they might have.
Sure.
Give them their insurance information, see what would be available. But I think it's really important for our community to understand the services that are available to them. And a lot of times they'll go to their doctor, like I said, they've had a stroke, whatever, and maybe their doctors don't even know exactly what is available for them. So it's great that we have you on the program to educate our community about the services. And so then when that happens, whether it's to themselves or a loved one, which a lot of times it's the family member
Right.
that is the one that's talking to the doctors, so then they can say, hey, wouldn't that aquatics therapy help? Or do you think that we should get someone to look at them in the wheelchair because they're having issues, whatever? And so they can ask for that.
Right, and it never hurts to have an evaluation, even if we find out things are fine or there isn't anything that someone might need. We can at least look, and usually 9 times out of 10 we do have at least some suggestions we can offer that might be helpful. But it's better to have somebody have a look and find out, and not need anything to have something that you need and not be able to get it addressed.
Right, that's great information to have. We were talking about the pool therapy and how, I don't know, just that idea of a nice warm pool just to me kind of went, oh, that sounds really nice.
Yeah, it was one of the best classes I ever went to. We spent half the day in the pool. It was wonderful.
Come out looking like a prude, maybe.
Well, yeah, there was
little
that.
waterlogged.
Yeah.
So what kind of exercises do you do in occupational therapy with the patients?
Well, I have a special certification in a technique called Aqua Stretch, and it's a fairly new approach. Actually, it's been out there a while, but it's just kind of now getting out to where people have heard about it. And there's a physical therapist up in Las Vegas that actually developed this, and it's being used all over the country. My instructor was actually Canadian, so I mean, not just here,
Right,
but other countries as well. They're using this new approach for. A lot of people have heard of things called myofascial release, and Aqua Stretch kind of has that same theory of, through even normal day-to-day use of our bodies, we develop areas where our connective tissue gets kind of hung up. And traditional methods of those myofascial releases tend to be a little on the uncomfortable side, to say the least. And this is a new way we can kind of provide that service in a less stressful way for the body to have to handle it, and less painful. And that's really shown helpful with people, especially with more chronic pain syndromes, fibromyalgia, and other conditions of that nature that people can't tolerate, that really difficult techniques that
Like the stretches kind of
right,
thing.
the Graston techniques, and there's wonderful ways to make that happen, but it's pretty uncomfortable. And for people that have pain issues to begin with, sometimes that's not very practical.
Yeah, I'm already in pain. Don't make me hurt worse.
Right. So this is a way that we can provide that same type of treatment in a less stressful way, and hopefully a less painful way.
That's awesome. And again, we want to make sure that people understand that it is a referral.
Yes.
That it isn't something
Yeah.
they could just come in and say, hey, I heard about this. I think I
Right,
want to do that.
right.
Can we
Yeah,
jump in the
no.
pool?
We need the doctor's prescription, and we
Right.
do need to, look at your medical history. There are conditions that we would need to take into consideration.
Like what? You
Well,
mentioned that,
if somebody has an issue with not being able to move fluid well in their body, congestive heart failure, there's things that we would just need to be aware of so that we take precautions if we need to make sure that you're safe in the environment that we
Sure,
have you in.
okay,
So,
okay.
so we kind of look at your medical history as well to make sure that
that's
what we do
smart.
is going to be safe for you.
Sure, that makes sense. That makes
So.
sense. And when we were talking about the wheelchair therapy, I'm kind of bouncing back and forth
That's
here, but I
okay.
want to make sure we cover all these bases. So, for instance, people with MS that are in a wheelchair. My grandmother was an invalid for 30 years, lived in a wheelchair for 30 years, and I know that was a couple of years ago now. And she just was in a plain old wheelchair. She didn't have anything special other than I know my grandpa used to get like sheepskin and some things like that to provide her some comfort because she was in that chair all day long. So you were talking about that there are special things that can be done to help alleviate those kind of
Sure, positioning, yeah. A lot of times I'll look at a power wheelchair so somebody can be more independent. It's one thing to have to be in a wheelchair, but to have to wait for somebody to push you from
Right.
the living room to the kitchen so you can get a drink of water, as people that are able to walk around and do stuff, we take that
Take that
ability
for
for granted.
granted.
And so just allowing somebody that independence to be able to take themselves to the bathroom or to the kitchen to get a drink of water can be a really liberating thing for somebody. And that's what we want to do. We want to enable them to be as independent as they can be within what limitations
Yeah,
they may
right.
have.
But that's awesome. I mean, that
So.
really is, and adds a quality to life
Yes.
that they obviously could be missing
Right.
if it wasn't for that. And I think it's important for people to realize that those conditions don't have to be just a end of life kind of thing or end
Right.
of quality. That there's options for them. So that's really super. So you're enjoying your time in Kingman.
I am.
What do you do for fun outside of work?
Well, I have 2 kids, and
Okay.
and they keep me on my toes.
Absolutely.
Like I said, my parents have they're snowbirds, and they're here. They actually should be here in a couple weeks, so we're pretty excited
Oh, good.
to have family around. And I love to hike, which this
Oh,
is
yeah, we
been
have
a
lots
great
of-
place to be. Yeah, I love being
Absolutely.
able to run up to the Wallapies, especially in the summer when it's hot down here.
Yes,
But now
yeah.
that it's cool, I can hike down in the desert, and
Right,
and
yeah.
I really enjoy that. Other than the snakes,
Oh, the snakes. Yeah, we'll just have to avoid those snakes. But
I've never seen one when I was out hiking. So
well, that's a good thing.
fingers
Yep.
crossed, knock on wood. So,
Well, and the one fun thing, like you talked about, maybe going to Idaho, and thank goodness you came here instead. We're all blessed
Yeah.
for that. But if you ever do get the little snow thing going, you can run up to the Wallapies. I tell the folks you can go play in the snow, make a
Yeah.
snowman, and then come back down and be out of
oh,
it.
well,
What a perfect winter.
my kids like to ski, so we run up to Flagstaff.
Oh, there you go. You're
And it's
close enough
2
for that,
hours.
too.
Yeah, it's
Very
wonderful.
good. That's great. Well, like I said, I'm really glad that you're here, Paige, and you've
Thank you. I'm glad
added
to
a
be here.
whole new service level here to KRMC. And again, the number is 692-4186 if people have questions. Thanks for joining us today. If you have any questions, give Paige a call, and I'll see you next week with a new guest.